Hi, everybody. I'm Dr. Bryan Ardis. This is the Dr. Ardis Show, and I am thrilled and honored to have my next guest with me, all the way from California, sitting in her plush, much deserved office loaded with books, certificates, you name it, all over the walls and diplomas. All right, we've got a special guest for you. We're going to be talking everything about the gut and its relationship to health, maybe the last 4 years with this pandemic we watched. She has been on the cusp, on the top of understanding how the gut microbiome literally led to worse outcomes in people with COVID, a topic most people stayed away from, never wanted to talk about. All they wanted to promote was remdesivir, COVID-19 mRNA vaccines that have never been tested or tried before the pandemic, hydroxychloroquine and ivermectin. I mean, this is all you ever heard. And then there was some random guy, some chiropractor, talking about nicotine and venoms related to COVID and all the worst outcomes. That was me. All right, so I've got Dr. Sabine Hazan here with me. She is a medical doctor and a researcher out of California, and she has a lot to say about the microbiome, and she is the expert. There are a few things I'm considered the expert in as I go around the world. Dr. Sabine, this is what I'm told. I'm called the remdesivir guy, the snake venom guy, now the nicotine guy. You would be the poop lady. Let's bring her on. Everything about what you did not know about your overall symptoms and health and how it's actually probably more correlated to things in your gut and not in your bloodstream, as everybody's told. All right, let's welcome to the show Dr. Sabine Hazan. Say hi to the Dr. Ardis Show audiences.
Hello, everybody, and I'm so excited to be here today. And thank you for having me. I'm very excited to speak.
Yeah, all right. Now, Dr. Sabine Hazan, you've got a bunch of stuff hanging up there on the back wall there. I want you to give your own personal bio to some of your achievements, some of your accolades, and then your amazing book that has the greatest title I've ever read. All right, go.
All right. Well, I'm a gastroenterologist by trade. I graduated at University of Florida. I was the first woman GI fellow there. The award right behind me is actually the Dean's Research Award. My attending when I graduated said, "You really need to pursue research." And I said, "Nah, I want to be a GI doctor. I want to scope and do all the things." But I still kept up with GI with research. And then basically, over the years, being a mom, two kids, research kind of became 50% GI, 50% research. And then with time, it became 90% research and 10% GI. When the microbiome became a crapsule, a poop pill, one could say I went rogue because I was the girl that was doing clinical trials for pharmaceutical companies for 3 decades since my years at University of Florida. And when those pills came on, I said to myself, wait, how do we even know anything about the microbiome? What are all these microbes? There's trillions of microbes out there, and we have no idea what we're doing. And now we're going to give literally pills of poop to patients. And what if there's like a component of compatibility, right? And that person is not compatible and it's going to do more harm. I'm from the training of do no harm, right? Try to do as safe medicine as possible. And so to me, I had all these questions and then, started testing my stools with different labs out there because I knew that there was something to it. I mean, here I come as a gastroenterologist that performs a procedure called fecal transplant, which is basically what we talk about in this book, fecal transplant, which is taking stools from a healthy donor and putting it in an unhealthy with C. diff. When we did that with C. diff, a lot of us started noticing a lot of different things changing. Myself, I saw a couple cases of psoriasis improving by changing, the microbiome, a case of Alzheimer's improving by changing the microbiome. My friend Sahil Khanna at Mayo Clinic saw chronic urinary tract infections improving. Dr. Colleen Kelly at Brown, at the time she was at Brown, saw 2 cases of alopecia areata improving with fecal transplant. So as we were seeing that, science, medicine happens with an N of 1. So as we were seeing that, we said, we need to understand what's going on. Why is it that Dr. Kelly changed the microbiome of these 2 people and they grew hair, but then some other doctor in Nebraska, we'll say, does the same thing and doesn't improve hair, right, in those 2 patients? So why isn't it reproducible? There is there are answers in the microbiome, but it's just so vast, so complicated, and that it's so complicated that you can't even like wrap your head around it, because it's all communities of microbes communicating to each other, feeding each other, working together, creating the health of an individual. So when you take those stools and you basically give a new microbiome to a person and you see changes, you have to follow the path. So what happened was, I knew there was some mystery in the microbiome. I knew that I was seeing something. I wasn't blind. Patient doesn't remember his daughter's date of birth, and then after fecal transplant remembers his daughter's date of birth with Alzheimer's.
Wow.
I saw something. So what happened is, I ended up going on this path and sending my stools, and you'll remember all these stool tests at the time. Ubiome, all these companies came out with test your microbiome, test your microbiome. So I tested my microbiome, the same sample, twice, different names, and I got completely different results.
Wow.
And that's when I said, wait a minute, something's off here. So I went from doing clinical trials with pharmaceutical companies to really putting my head on the microbiome and doing clinical trials on the microbiome. But I had to create the lab. So I became the CEO of a company called Progenibiome, where we are the genetic sequencing lab that found COVID in the stools, that discovered the power of the microbiome during COVID. With me first, right? I was the guinea pig. I was basically on the front line, without a mask, exposed to thousands of patients. What made me so resilient that I could survive not catching COVID, patients after patients, not using hydroxychloroquine, not using ivermectin? What was the mystery in my gut? And then from there, looking at like 72 patients, hundreds of patients, and seeing that same formula of resilience, and so from there, obviously we opened a nonprofit to raise money to the Microbiome Research Foundation to pay for all these stool testing. My life is a research lab. I go to Zimbabwe. I'm the girl that analyzes the poop of the elephants instead of taking pictures of the elephant. So and the lions. So I'll go in front of the lions and I'll just collect the poop. So this is what I've done. This is my path. This has been my pursuit, my passion. Nobody likes to play with poop, obviously, but
I do.
There you go. Well, there's something to, the mysteries of humanity in poop. And, I always say God has a sense of humor to put the mystery of disease in poop, right? So,
So let me set the stage for a few people here. I'm going to pretend like I am a listener at home and know nothing. So as big words are being used that maybe they don't have definitions for, I like to make sure that as we discuss certain health topics and these Latin-based terminologies that most of us are forced to learn in our different graduate schools, I want you to define for everybody watching, what is a real basic definition of the word microbiome?
So microbiome is essentially all the microbes around you, on your skin, in your nose, in your mouth, in your eyes. There's a microbiome of the eyes. There's a microbiome of the nose. There's a microbiome of the mouth. There's a microbiome of the lungs. There's a microbiome, in the blood vessels. So it's all the microbes, and give
us some examples of microbes. Are you talking like worms or bacteria?
Well,
or fungi,
everything. So if you're looking specifically at the gut, right? If you're looking at the gut, you're going to look and you're going to find, some worms, you're going to find some parasites, you're going to find some fungi, you're going to find some bacteria, you're going to find a lot of bacteria. 80% of your gut is like bacteria. And you're going to find a lot of viruses, because viruses are much smaller than bacteria. So when you look at a stool sample, yes, you've got the waste of the foods, right? But you also have the microbes in there. So what I focus on is mostly the microbiome that's in the stools, in the poop. So when I wrote the book, Let's Talk Shit, it's literally, I could have said, let's talk microbiome. And actually my publisher was like, do you want to rename it and call it Let's Talk Microbiome? I said, I want people to know, I want people to understand what we're talking about, that these are stools we're talking about. When we talk about a microbiome capsule, it's a poop pill. There's no other ways. Yes, we remove the
And you
food.
swallow it?
Yes.
You swallow these pills?
The pharmaceutical pill that it just came out and was approved by the FDA. Yes, you swallow it. And by the way, I did those clinical trials at the beginning when we were for C. diff. And let me tell you, I was mortified to give that to patients because I'm like, oh my God, I'm giving a pill full of poop that I don't even know who the donor is. It could be an anxious kid from MIT, and then you kind of start seeing things happen, and you get over the poop factor. You get over the shit is a bad word. No, it's not a bad word. You need every human in the planet is flushing and looking at their poop. Every human in the planet sees a change in their poop and says, I wonder why my stools are floating. I wonder why they're yellow. I wonder why they're red. What did I eat last night? I wonder why they're not sinking. I wonder why they're not brown. I wonder why they're pellets, right? So all these questions. And by the way, this has been my life for the last 3 decades of being a gastroenterologist. Doctor, can I send you a picture of my poop? No, don't send me a picture of your poop. Let me analyze it, right?
I want the actual poop, not a picture. Send me the poop.
And here's the thing, right? So people notice, one of my neighbors is a huge manager of a lot of celebrities, and he jokes with me and he goes, every time I flush now, I think of you. I go, well, there you go. I branded myself really well. Now you're thinking to look at your poop.
All right. So for context, let's continue. I want to know, what about the word you haven't said yet, but I'm very curious. When people picture microbiome, are they also saying the same thing as like probiotics, or are those something very different? Because everybody's trying to swallow those things. Are they the same as these poop pills that are microbiome?
Yeah, so probiotics is another fancy term like microbiome, right?
Okay.
So instead of saying shit, we're going to call it microbiome. Probiotics is a fancy term for good bacteria, right?
Yep.
And so for years now, we've determined that the good bacteria is bifidobacteria, right? So they looked at newborns and they saw the newborns have a lot of bifidobacteria. That must be a good bacteria, right? So probiotics is essentially that trillion-dollar industry of good bacteria, which is bifidobacteria. Now, the problem is with technology research, we're discovering a lot of other bugs that are good bugs or bad bugs, right? And some of them, so you think about Akkermansia now is a new probiotic. Well, is that a good bug or is that a bad bug? Is it a good bug for some people? And is it a bad bug for other people, right? So people are taking on the term of probiotics loosely to say these good bugs, which, by the way, everything is branding, right? You know that, I know
Yes,
that.
I do.
Vaccines have been branded.
Safe and effective.
Branded so well that people just write on the narrative of, oh my God, it's a vaccine, it's safe and effective because that I heard that since my childhood, right? So anything that could come out, like I could use ivermectin as an injection and call it a vaccine, right? And people have tried to do that. And therefore, people will buy into that because it's the brand that you're buying, not the technology. So probiotics, it's a brand. Microbiome, it's a brand. Vaccines, it's a brand.
How about biofilm?
Oh, biofilm is another brand, right? Somebody figured out.
So what is biofilm?
How is that different? Biofilm on the colon.
How is it different than microbiome? How is the biofilm different than that?
So the biofilm is really that layer that you really can't identify.
Okay.
That is basically, I like to call it the layer of crud that accumulates in your colon, right? So you're doing you're taking some aspirin. Well, the aspirin doesn't really decompose. A lot of it kind of stays there. You're eating, my least favorite food is chia seeds, okay? You're eating some chia seeds, okay? They leak. They have, if you leave chia seeds, and I welcome everyone to do that experiment at home, leave chia seeds in a glass, put a little bit of water on top of the chia seeds, leave it overnight, and then watch the chia seeds stuck to the glass. Now, what's going to happen is you're going to put some orange juice in there, pretending it's acidic food. You're going to try to remove it. It doesn't remove. It's very, very hard to remove, right? That's what I like to describe as the biofilm in a way.
Very good.
It's that crud of leftover, of toxins, of glyphosates, of things that are added, preservatives that basically stays on the colonic mucosa and doesn't allow those villi to pass. But of course, the medical literature has not caught up on that. The medical scientists have not caught up because this is not something we analyze. This is not something we look at. Dr. Barodi and I, who's the second author on the book, Let's Talk Shit, basically wrote the book, and we recognize there's a biofilm. Why? Because in order to do fecal transplant, we need to get rid of that biofilm. We need to get rid of all the bad microbes. We need to get rid of the biofilm. We need to see the villi, the mucosa opening up again in order to transplant new microbes. And I always give this example of, gardening. If you're gardening and you're taking out weeds, which is, blocking your garden from growing because there's all these flatbed of weeds, that's your biofilm, right? So I'm taking off the weeds of my garden. I turn the earth, right, to give it some good minerals, good microbes, and then I plant my seeds, and then I put some water, then I put some oxygen and sunlight, and then slowly, provided there's no tornado, earthquake, or fire, your plants are growing nicely. That's the same in your colon. Don't think we're any different than plants, except our microbiome is what's doing everything. So our microbiome needs to have peace. It needs to have sun. It needs to have water. It needs to have the good nutrients you feed it. And then all that machine starts working and gives you focus, gives you, good skin, gives you good nails, gives you good hair. All that focus is basically, so don't think that I'm just going to take a healthy microbiome and plant it in someone, in my kitchen counter with a blender and expect any results, because unfortunately there's like a lot of steps that need to happen in order for that microbiome to implant and in order to grow good microbes.
Well, that's a perfect analogy, like the garden analogy. All right, so taking it a step further, this discussion I'm very excited about. I've wanted to do this with you for a long time. It's been a lot of media lies and deceit around a whole lot of topics that we've had to address in lots of travels, but I'm very excited to help my audiences understand the reality behind your gut health and the rest of your health. Because so many people have been conditioned traditionally and medically that there's one test that you need to run on everybody in order to see if there's any cause for your symptoms that you're complaining about or you're suffering. And that would be a blood test. All right. So from your perspective as a medical doctor and a board certified gastroenterologist, has it been alarming to you that coming out of med school and not learning more about the gut's health and its impact on the rest of the human body's health, are you shocked, and do you continue to be shocked by even your profession and other colleagues that more education and knowledge and clinical effort and testing on stools is not performed, and most people are left to guess from the blood work what might be your problem? Is there a direct connection you have found, a reality that's new for you since leaving med school, that the bowel, the gut, the lining of your gut, the microbiome in your stool sample has a direct effect on almost every part of the human body's experience? True or false?
Yeah, so definitely true. I think medical school, but you have to remember, science evolves, right? Mm-hmm. We've been focused on the blood, for decades now, right? Because it was a new finding. Remember when the CBC came on, when we tested the CBC, we basically, that was a revelation. That was a new thing for all of us as doctors. Sure. Imagine, obviously it's not of my generation, but imagine those doctors during that time that were, wow, patients are bleeding. We get to have a test that shows us the patient is bleeding. And now we get to know what level do we give the blood before the patient dies, right? Yeah. So that was a brand new, amazing tool that we acquired. From there, we discovered hemoglobin of 7 and less, we probably should give a blood transfusion. But then we discovered if you give a blood transfusion, you can catch these viruses because blood is not clean. Because think about what blood is. Blood is the transport, of everything. It's oxygen, it's hemoglobin carrying the oxygen, but there's also viruses that are passing in the blood. There's also, that you need to clear, right? So they're going from the brain to the gut, everything circulates. That was the big joke about the pandemic, was when they said, oh, the vaccine stays in your deltoid. How could it stay in your deltoid? The deltoid is connected to the blood vessel, to the nerve, to the muscle, to the skin. It does, there's a song about that. Every organ is connected, right?
That's totally ridiculous, by the way. And let's just talk about that for a second. All right, the deltoid muscle, it just stays there. Okay, even if it did, and they wanted you to believe that, I would like anybody to open a medical reference textbook of any kind, go to the immune system section, and somebody tell me that the deltoid muscle is a part of the immune system.
Yeah, no, it was ridiculous. The whole thing was ridiculous. And that's the problem, right? So here's the problem is the technology of the CBC was great until we discovered hemoglobin of 7 and lower needs blood transfusion. Hemoglobin of 14 and above, that's a condition called hemochromatosis. Yep. Hemoglobin that has the blood has viruses, and therefore we should test for hepatitis C, HIV, etc. Right?
How about hemoglobin A1C? That's a new thing, right?
Absolutely. So that was the beginning. Then that led to other things in the blood, always focusing on the blood, and thus the whole path of immunology, right? The blood and immunology. But guess what? We forgot the most important system that we all learned, which was immunity starts in the gut. Why is immunity starts in the gut? Because there's microbes there. Nobody wanted, we have been trained and branded again to focus on microbes are bad. Kill the microbe. Microbe is bad, kill it, antibiotics, and then move on, right? Streptococcus bad, kill it, move on, right?
Germ theory, all these bacteria in the gut have to be germs, right? Wipe them out.
And by the way, those were great discoveries, right? Think about it, like, the obstetrician that decided to wash his hands before, delivering babies, and then he was put in an insane asylum because of the fact that they thought he was crazy. Well, years later, now we're using gloves, we're sterile in a pregnancy, right? Now, here's the problem. You have like two trains of thoughts, right? You have Pasteur, which is pasteurizing everything and sterilizing. And you've got Béchamp, which is the terrain health, right? Somewhere in the middle of those, and I'm going to bring those two together to kind of say the Hazen method of middle ground.
I love it.
It's about killing the bad one and replenishing the good one.
Okay, and name a few bad ones for me. Name a few bad microbes that you have found consistently or bad.
C. diff. For example, C. diff, right? A bacteria
which is a bacteria. Okay, good.
It's a bacteria that was misunderstood. For 30 years, I tried to kill the bug. I did multiple clinical trials on it. Vancomycin, Flagyl, fidaxomicin, also called Difficid, monoclonal antibody, poop pill. So what did I learn from all that? This is the advantage, by the way, of being a physician on the front line of research doing clinical trials, is you get to learn what others, I've done over 300 clinical trials. And then with my sisters, between my sisters and I, we have probably about 500 clinical trials under our belt. So Lydia, my sister, actually is the one that brought ivermectin to market, and Harvoni. She took it from phase 1 all the way to market. So the girl is like a genius marketer at bringing in products for pharma. So we've done all sorts of clinical trials. So when ivermectin was a drug that was basically given to babies for scabies on her clinical trial, and then all of a sudden you can't give it to COVID, my radar went off. I'm like, what do you mean I can't give ivermectin that I give for babies with scabies to a dying patient with a low oxygen? And by the way, I've seen it work. It increases the oxygen saturation. I saw it with my own eyes. I took the picture of the oxygen saturation of patients. And by the way, I included Twitter at the time. I was with my followers. I was like, guys, pray for me, oxygen 63. And then 5 days later, I would show like oxygen of 95%. I did that to in real time. You know, I could have said, oh my God, my patient died 63, but no, he didn't. He's still alive.
Did Sanjay Gupta on CNN go on the media and tell him that Dr. Sabine is using horse paste to increase her oxygen levels?
That, by the way, that pissed me off so much because it was, what's that comedian, Mayers, whatever, that comedian talked about horse paste. And his manager is actually one of my neighbors. And I texted him. I'm like, tell him to stay quiet. I mean, he's interfering with my research. I'm like, this is ridiculous. You guys are like screwing up humanity. These drugs are safe. They're given to babies with scabies. You know, hydroxychloroquine was given to patients with arthritis for years. What are we doing here? Why are comedians talking about medicine? They have no idea. And by the way, if they want to talk about medicine, hey, I can give them my phone and they can start taking care of all my patients, because I didn't need to take care of 52 patients a day in my clinic. I could have focused on my husband. I could have focused on my kids. I could have focused on my parents, could have focused on me. You know, I mean, this was not a reality that I wanted. I didn't want that. You know, I gained 40 pounds this pandemic, just sitting, taking care of patients, stressing and eating. I didn't need that. My body didn't need that. But
you were a literal hero, which is why you're on this show, young lady, and why we continue to converse. Anyway, everybody, you should trust her. I do.
Yeah. So basically, I didn't need to do any of this. Okay. But I felt like, wait, what's going on? So let's go back to C. diff. C. diff is a bacteria that I tried to kill for years. What I noticed from C. diff is that it wasn't about killing. Every time I kept killing it, I would drop the diversity. So if the patient started off with a diversity, Shannon diversity, that's how we measure the amount of diverse microbes in the gut.
Thank you for defining that.
Thank you. Whenever the patient had a diversity of, let's say, started off with 2, okay, I would give him vancomycin. Then I would test the stools a week later on vancomycin. And I would notice the diversity dropped to like 1.5. So in my mind, I was like, well, that's not the answer. He keeps dropping diversity. We need diversity, right? And that's what we discovered through my research in the lab for Regenebiome. So then we gave him fidaxomicin because, of course, the patient would come back with C. diff. It's basically like having a bug that you're trying to kill, but you're using a machete to kill it. You're killing everything else, but you still miss the bug, right?
Got it.
And so what happens is you now have low diversity, but you miss the bug. So the patient comes back 3 months later with C. diff again. So now you give him another antibiotic, and that antibiotic drops the diversity again. So what do we do when we do fecal transplant? We give microbes, we add diversity, we give a new microbiome. So that's what I learned through the microbiome, right? It was, C. diff was misunderstood. It wasn't. And by the way, when I tested my stools the first time, because I was the first person to test, I noticed I had C. diff, non-toxigenic. I don't have diarrhea. I didn't have diarrhea or anything. But in my mind, I was like, I was asking myself, maybe I got it from a patient because I do a lot of fecal transplants. And then, you know, I tested my husband. I'm like, well, maybe he got it from me. Then I tested my kids. Then I tested. So the whole time, we tested about 200 patients. That was the first study that came at the American College of Gastro as an abstract. We tested over 200 patients and we presented the data that every one of those patients had C. diff in their gut, yet didn't have diarrhea. So you look at C. diff, right? And you say, well, in some people, it's a bad bug. Why? Because they lack diversity. Because they probably took antibiotics before that killed their microbiome. And therefore, C. diff woke up and became exploded. A terrain of C. diff. Because now it's like a hotel that's empty. And now, you know, you bring in all your, you found out a vacant hotel and you call in all your relatives and you're like, hey guys, come on in. This hotel is vacant, right? Same thing, right? C. diff is there. It's like, hey, free.
So now the whole hotel is full of Hazan family members. Hazan family members only. Okay,
that's it.
Yep.
So C. diff is that, right? And I know like people are listening, your followers are probably going light bulb, light bulb, light bulb, because here's what happens. Every one of those every person that got C. diff, every single one of them can go back to their history and say, you know what? I did take antibiotics for that ear infection. Wow. I did take antibiotics for that C. diff. I did eat a hamburger that was improperly cooked, that probably was, or where the cows were over vaccinated or over given antibiotics. Remember, the process in farming used to be that cows would be fattened up with antibiotics, right? If you want to fatten up a cow to have that big juicy steak, give it some antibiotics and it'll be a big fat juicy steak or a big fat juicy turkey, right? That's what they did. So when C. diff started going rampant, fecal transplant became a way to fix C. diff. But by the way, about 7-8 years ago, the FDA stopped the practice of giving antibiotics to cows because they realized, yeah, this may play a role because we're having kids with C. diff. When have you ever heard of kids with C. diff? Yes, people in a nursing home, in a hospital, the hospital, the nurse is not really, it's not a sterile environment. You've got some C. diff in the, Dr. Alex Carruthers did a great study where he basically tested the patients, he tested the chairs, the cabinets, everything, and there was C. diff everywhere. And he's like, C. diff is contagious, it's everywhere. And I said, and I would debate with him because I would say, and that's the beauty of science, right? To debate.
Amen.
And I would say, well, Alex, how do you know, like maybe it's just the immunosuppressed, the people that have low diversity that are catching. Maybe the rest of us, it's building up our immunity. Maybe I'm never going to get C. diff because of the fact that I've been exposed to so much C. diff in my life, right? Or I could drop my immunity, be stressed, eat the wrong foods, take antibiotics, take all sorts of other products that kill your microbiome. And then next thing you know, I would get C. diff because it's in my gut, right? I was exposed to it.
Very good.
There's your bug, C. diff.
C. diff's the one bug. Okay, name some other bugs you're finding commonly in research studies now, and people in America that you were like, are any of you shocked by now? You're like, man, I had no idea there was so much Cryptosporidium parvum out there, this parasite showing up everybody's stool. Is there anything like that you find commonly as an issue? E. coli, yeast, Enterobacter, Salmonella,
so E. coli. Let's talk about E. coli. E. coli is a good bug and a bad bug. It's one of those. It's good. It absorbs potassium. It's good. But it's also bad in that it causes diarrhea, and there's different strains of E. coli, obviously, and different E. coli secrete, different toxins. So E. coli is another one. I find that E. coli is particularly interesting because you don't need much to implant E. coli. And so, playing with E. coli is a dangerous practice, in my opinion. And certainly, we've certainly seen that, with the whole vaccine engineering of E. coli with it. So anyways, so that's basically, bifidobacteria itself is very interesting, right? There's different strains of bifidobacteria. Some are not necessarily good for everyone. Everybody has different strains. Also, is bifidobacteria up to a certain level not good, right? Is it good up to a level and then too much of it may be bad, right? Those are the questions. Akkermansia is an interesting bug as well. Is it a good bug? Is it a bad bug? We're sorting through that as, we're doing 57 clinical trials on the microbiome and disease. So please support the foundation, whoever's listening, the Microbiome Research Foundation, because that's how we get the money to do this kind of research. That's not really selling a product. We're not there to sell Akkermansia or bifidobacteria. We're there to basically sell the good data, the good products that show clinical validation. We want to support good companies that are doing it right. There are amazing companies out there that are, and I'm a stickler for going to the company. I'm a detective, right? So the company that makes me my vitamins, I checked it out. I check out what their product does, where they get the products. I also verify the supplies because I want to make sure there's no arsenic in my vitamins, that there's no other junk that's going to affect my microbiome. Because here's the thing, you can take a vitamin C and D to increase your bifidobacteria. We showed the data that vitamin C increases the bifidobacteria. By the way, all my data is on the Progenibiome website, whoever wants to see it.
Spell it for them so they know where to go.
Yeah. Pro Gena, Gena, biome, Biome. It's too long, but it comes from progeny, from your genes to your microbiome. So Progenibiome is where it's all from. .com. So it's in the publications. You'll see vitamin C. So now here's the thing. A lot of people come to me and they're like, but doctor, I read your paper and I'm taking vitamin C and my bifidobacteria is not high. Why is that? And I tested before and after with you and it's not. Well, when we test the vitamin C, we noticed a lot of junk in there without saying, the direct compounds. There's a lot of junk in there. And you have to remember, where are your vitamins made? Are they made in a factory in China where, if you've been to China, have you been to China?
Nope, never.
Okay, well, I've been to China. I've been to Nanjing. I was asked to speak at Nanjing on cutting edge medicine. And, I visited all the outskirts and I visited some of the factories. And the shocking thing to me over there was like, there's a lot of areas where they don't even have a bathroom. They have a hole. So people are literally, doing it in a hole and there's no toilet paper.
Wow.
So you gotta, so that picture in my mind stays where, when I see vitamins that are made, in China, I ask myself, is it clean? Is it because remember, it's about cleanliness and it's about repopulating with good microbes. You can do non-clean and repopulating, right? It doesn't work because then there's a lot of bad microbes in there. So it's that balance of killing the bad and boosting the good and keeping it and realizing that not everything is good, not everything is bad. Some of them are good up to a certain point. Some of them are bad up to a certain point. So it's really keeping that balance. I think when, the symbol of medicine was the scale, it couldn't have been a better symbol. And,
I believe you.
We have to follow. And then, by the way, the snake.
Now it's a serpent.
And I think that's where your thing came on with the venom is the snake and the scale. So he probably guided you. It's so funny, Bryan, that we're talking, you and I, today, because when I heard you at the beginning, and I have to be, fully transparent. When I heard you at the beginning, I was like, this guy is off. He's wrong. And remember, I told you, I go, Bryan, you need to do the research. You need to show the data. You can't convince anybody, right?
Amen.
But here's what happened is with what I realized is there's a scientist in you that's a budding scientist that sees a vision, and we need to enhance that vision. I think what happens is we fall as doctors too much in that God complex of, oh my God, it's my way or the highway, and I always fight with, the guys, and by the way, Dr. Barodi, who I adore and who wrote the book with me and who has been the father of fecal transplant during COVID, him and we were like, practically butting heads. And I'm like, Dr. Barodi, no, that's too high of a dose. And then he'd be like, Sabine, no, it's not too high of a dose, et cetera, et cetera. But here's the thing. There's a genius there. You got to let that genius flow, right? Because as crazy as when he told me, try 36 milligrams of ivermectin, I'm like, 36? I mean, like, I'm used to like 3 or 6. The patient was dying. He was on his way to the hospital. And Dr. Barodi in the back, I had that little planted seed in there. Try the 36, right? When he was drafting the protocol, we wrote the protocols on hydroxy, Z-Pak, vitamin C, D, and zinc for the FDA to approve for us to do the clinical trials. And we wrote the ivermectin, doxycycline, zinc for the FDA to write the protocol, to approve the protocol.
Awesome.
So we were, back and forth. He had his team call a bunch of people. And by the way, China is great. as far as like there's a lot of brilliant scientists out there. There's things that could be changed in the environment, the pollution. The poor guys are dying of like 7 times more lung cancer than everybody else for, I always say it's for the price of a cell phone, because we need to redo this cell phone every 4 years. So these poor guys are having so much pollution from the manufacturer and the continuous business of cell phones and technology, etc. So they're to blame in a way, and I feel sorry for that community and for the people of China personally
I'm sure.
that are living there. In those conditions, not having evolved a little bit in the factories, not taking care of their factory workers, so that's that. But anyway, so Dr. Baroudi, I remember that 36 milligrams, and then I gave it to a patient whose oxygen was like in the 60s. He was on his way to the hospital. He was dying. I mean, I knew once these people were getting to the hospital, it was like goodbye, like write your will. And he got into the hospital, but I told him, I go, stop by McDonald's, take some French fries, because that was a like high fatty meal that I could think of, and take the 36 milligrams. He arrives in the ER with an oxygen saturation of 92%.
Wow, that's incredible.
Yeah, and that was the first case, because that guy was on my placebo-controlled clinical trial. And the ER doctor said, whatever that doctor's doing, just follow her, because she seems to know what she's doing. Go home.
That's awesome.
Just call the doctor. And he lived. And by the way, he was diabetic. He was overweight. He had kidney problems. I mean, this was like a guy you would never expect to survive. And that gave me confidence, right? So this is how, doctors, debate. But then somewhere along the line with that genius, came out, hey, maybe I'll try 36, because guess what? He's going to survive. So we tend to be stuck. Like I listened to Peter Hotez, right? And Peter is stuck on his vaccines. Like, vaccines save lives. He believes in it. Because think about it. To not believe in that is to go back to a whole career of having pushed that and saying, oh my God, I messed up. Amen. I have that personality that I'm like, listen, if I mess up, I'm the first one that's going to tell you, And by the way, in a way, when I was doing the hydroxychloroquine, Z-Pak, vitamin C, D, and zinc, that was my patent. I could have easily sold it and said, that's the answer. Everybody needs to take it for COVID. Yep. But here's the problem. It kills the virus, as we saw it in our lab, because we were the first lab to isolate COVID in the human samples, not in the septic tank, in humans. And so we had the clinical data. And so what happened was, when we had the clinical data, we saw people that took hydroxychloroquine and it killed the virus. But here's the problem. It also kills the microbiome. And remember how we talked about biofilm? Yep. It's a pain to get rid of that once you have it in your system. So you got to be careful of everything you're doing and what you're taking on, and not just believe because somebody, yes, hydroxychloroquine Z-Pak worked for the guy that was diabetic, COPD, CHF, heart failure.
Wow.
Because he has no microbiome, most likely, right? So I got to hit that guy with hydroxychloroquine really quick to kill the virus as quick as possible, okay? Otherwise, the guy's going to have a hard time surviving. So my focus when I was treating on the front line was, how's my patient? Who's my patient? Is my patient diabetic? Is my patient overweight? Is my patient? And then right away, I was like, okay, he has a 50-50 chance of dying. I'm going to hit it hard. Or my patient is a young athlete, okay? I'm going to look at that patient. I'm going to say, he doesn't do protein powders. He's healthy. He's eating fine. I think he's going to be fine. He's got a 99.99% chance of surviving. Why am I going to give that person something? Let his immunity build it. Let his body. We've been conditioned to take pills. We've been conditioned to have fear, because that fear is what makes us buy stuff.
How many people, can I ask you a question? How many people you treated for COVID-19 on the front lines? How many of them did you think, man, we should really just give them a small or large dose of remdesivir? That should handle it. Did you recommend that to anybody? Did you find that ususeful? Hey, good. Just checking. Thank you very much. That's great.
But I also know the chemical component, the chemical formula of remdesivir. I would
Yeah.
never give it. It affects the
Thank
kidneys.
God. Love
So
that. Love
no,
this lady. She knows the truth.
I would never. I mean, like, first of all, the pain of getting an IV, getting an IV nurse, hiring an IV nurse during COVID, that was not an option, okay? Because
Amen.
we had a hard time getting people to put halters on patients, which, by the way, was my pet peeve. If you ask me what is my pet peeve from the pandemic, was hiring these technicians that risked their lives to put halters on my patients, publishing the data that hydroxychloroquine and azithromycin did not cause QT prolongation, and then having that paper retracted. That was my pet peeve, because I'm like, wow. First of all, we spent $3,500 per patient. So multiply that by 100 and you'll know how much I spent. And then because we had to pay the technician, I wasn't going to, I double paid them because they're risking their lives.
Yeah. It's a pandemic emergency.
And to find a nurse that was going to go home to patients' houses and give IV infusions in California, good luck. That did not happen, especially as California was on lockdown. You couldn't go anywhere. It was just a nightmare. So, and everybody was scared in California. So remdesivir was never an option. And also, I knew the investors of remdesivir. I know the company. I've worked with Gilead in the past. Please, I mean, they were great with Harvoni, but let's stop at, remdesivir was not an option.
So one of the things I've learned,
an option for a lot of hospitals, by the way, because they were paid to do the clinical trial. And they were
that was the benefit to remdesivir. Yep, that was the benefit to prescribing and actually giving remdesivir. Hospital payouts from Medicare and other groups. Yeah, it was awful.
Correct.
All right. So what I'm learning from this entire discussion is not everybody has the exact same makeup of the different bugs that make up your microbiome. And no matter what you have been told about C. diff, E. coli bacteria, its amounts, even if it's detected, it doesn't always mean you're going to be sick with symptoms, correct? Correct. All right. It is really more the diversity of the various bugs that make up the microbiome.
And diversity of good bugs, because you can have diversity of bad bugs, and that's not a good thing.
Okay, so this is my next one. So you're learning that not always, if you have E. coli bacteria or salmonella or whatever, C. diff, it doesn't always mean you're going to be sick and you have symptoms and you need to be treated with antibiotics. Okay, that's number one. Number two, is there, Dr. Sabine Hazan, is there actually any good lab stool test from LabCorp, Genova Labs, or Quest that Americans typically will be referred to for a stool sample test that you believe is comprehensive and adequate to analyze for that diversity of bugs in Americans' stool samples?
So here's the problem with the testing out there. The majority of them are testing PCR, which is a small portion of the microbe. Okay. Just because you've got a small portion of the microbe does not mean you have a microbe that's alive. It could be dead. Okay. It doesn't mean that it's secreting a toxin either. So a portion of the microbe just tells you, yeah, you were exposed. You had it. So
the real question is the people watching this, is there some test that they should be asking their medical professional
Unfortunately, no.
From LabCorp?
Unfortunately, no. Unfortunately, no. So we are writing the data. We are writing the clinical trials. We have the clinical data. ProgenaBiome has the clinical data.
Wonderful.
Some clinical data. We need more. We need funding to get more data. We need to get the stamp of approval by the FDA and the National Institute of Standards, which overlooks FDA anyways. So I work with Scott Jackson at the National Institute of Standards. If you recall, I did the Malibu microbiome meeting. Scott always speaks at my meetings. Scott did an amazing study where he basically recreated a model of poop. Okay. He's at NIST, National Institute of Standards. Okay. And basically he took a model of poop and he gave samples to different labs. And he showed that there's an enormous variation between all the labs. In other words, and this is a controlled setting of the same poop, okay? That he collected appropriately, with a standard operation procedure, that basically gave exactly the same amount to everybody. There was no contamination. So everybody should have had the same stool results.
Got it.
There were differences, enormous differences. That paper is going to be coming out soon. So I tell you to follow Scott Jackson on Twitter. He's on there. This is an amazing paper. The Malibu Microbiome meeting, we're going to be posting his video where he discusses that data. So unfortunately, no, there is not. Here's the problem with the microbiome. The microbiome is capturing a stool sample. So what we do in our lab is whole genome sequencing. We look at the whole entire microbe.
Good.
And do deep sequencing, which is extremely expensive to get to that depth of stool samples to see the base of your colon's microbes, right?
Got it.
The thing with that, once you see that base, I should be able to take my stools today, tomorrow, next year. If I don't change anything in my diet, it should be my signature microbiome, okay?
Okay.
So our lab is basically valid, verified, and reproducible. And that's how we're able to show these data of these papers of vitamin C increases before and after within the individual. So at best, microbiome testing right now is a research tool. It's a research tool that allows us to see the before and after. So in other words, I gave a patient vitamin C. What changed in his microbiome? Oh, bifidobacteria increased. Okay. Now, here's the other problem. When you do stool testing, you got to make sure you have procedures in place, that you're not testing the toilet paper or the toilet water, or that the patient's not coughing on it, or you got to remove all that. And then also you got to remove like all the foods they've eaten, right? You can't compare a vegetarian to a carnivore. And let's say I eat fish one day and the next day I eat meat. Well, I'm going to have a different microbiome. You got to remove that from the equation in order to see that baseline of your microbiome. And here's the other biggest challenge. The microbiome is different in every different areas of the colon, and it's different in your small bowel, and it's different in your stomach, and it's different in your esophagus, right?
Hold up. Wait, do you require people to submit a food journal for like 7 days leading up to your stool sample so you know what to exclude?
But we do get a stool, so we do get a journal of what they eat.
Okay.
And we go super deep so that so in our validation, we've basically made sure that we have a reproducible assay without saying what we do and how we do it and all that. So, but we have standard operating procedures in place to make sure, and we train our staff so that even if I test my same stool, but a different technician comes and uses the standard, it's going to be the same stool sample.
Very good. Okay.
And all right, we have clinical data. That's the most important. In other words, if I see something's off in a microbiome of a patient, okay, I'm comparing a bunch of kids with autism, okay, and I see the majority of them have 0 bifidobacteria, but I see one is off, okay, he's got a lot of bifidobacteria. So the first thing I'll do is call the family and say, did you forget to tell, was something significant in your kid that I should know about? Did you forget to tell me that your kid was on probiotics? And how do I know? Because when I go to the species of the probiotics, I know the probiotics from the strains that are naturally in that kid, right? Yeah. So, inevitably that ability to call back the patient. So every patient that joins our studies, so we charge half of the price that it cost us. Okay. And the foundation pays the other half. And this is why, again, please support the Microbiome Research Foundation.
Amen.
When we test the stools, we tell patients, they sign a full-on consent. It's like 20, 25 pages. It's a pain. I realize that. But unfortunately, that consent allows us to call them back and answer more questions that we have or add something else. Like I was doing an anxiety study and I wanted to kind of see. So what I did is I basically, told my staff, call those patients and see if we can get an anxiety questionnaire. So that we have the stools, but we want to see who's anxious, who's not. So we have to contact our IRB, regulatory board, and then basically, they approve the questionnaire. And then we could go back to all those patients and say, could you sign a questionnaire so we could look at that?
Well, I wanted to pull up your website here so people can see where they can learn more about your clinical trials, your publications, anything showing them now the correct spelling of progenobiome.com and what kind of things would you like to highlight on this webpage will help people navigate this info to see whether or not they want to build confidence and whether or not they would like to have their bowels tested and their stool samples tested and have you as the expert help them figure out what's the correct biodiversity for their microbiome. Take me through this website and any ways in which we can help guide our audiences to know how they can confidently go to this site and get your input possibly on their own health or a loved one's.
So the first paper is actually, we were the first lab to identify COVID in the stools of patients. So this is an incredible paper.
Yeah,
If you go down, you'll see, pictures of the viruses in different seat, this one.
this
And
one.
you could see patient 1 to 12, you'll see like there's different shapes of the virus, right?
Yep.
And how everybody is different. So that was the first paper that kind of showed us the the mutation of this virus, right?
Okay.
So, and then it also told us that in some people, like, that, it showed us that the people that were negative, like myself, my scientist, we were negative for COVID. We didn't find it, but yet in patients that had positive PCR, we found it. So that was an amazing paper. The
Awesome.
second paper is the lost microbes of COVID-19. That's a key paper that's actually, in my opinion, is the beginning of looking at what a leaky gut is and gut
Got it.
dysbiosis. It's really the loss of those two microbes that you're highlighting.
Yep.
It's the increase in the Bacteroides, and it's the decrease in diversity. So so these two microbes, in my opinion, are key microbes to immunity. If you go down, you'll see, so the key people that are in this paper, FYI, so there's me. Dr. Stolman is works at the American College of Gastro. He's like he's on the board. Hussein Bozkurt is a gastroenterologist in Turkey who's done a lot of work with probiotics in Crohn's disease. Eamon Quigley, the last person, is the physician, a gastroenterologist who is the father of probiotics.
Wow.
And Tom Barodi is actually the father of fecal transplant. So these, so to me, having Neil, Hussein, Eamon, and Tom Barodi in that paper really validated my work, gave it some credibility because they would never put their names on that paper if it was not a key paper. And I think this was a key paper to the pandemic. It was reproduced 3 to 4 times by different labs that showed our data, and thus the importance of bifidobacteria in COVID, by the way. So this was a great paper that showed me the importance for me of bifidobacteria, of maintaining bifidobacteria, for me to survive COVID. I test my stools on a weekly or monthly basis. I always say, I'm the most expensive wife, because I don't buy Gucci shoes. I analyze my stools for thousands of dollars. Anyways, keep going down. The microbiome based hypothesis, sadly, this was a hypothesis that was written to showcase that maybe ivermectin increases bifidobacteria. It was a hypothesis written first, and look at that, it was retracted. They retracted a hypothesis. Where is the status? How can we call it science when a hypothesis is retracted? You can't.
It hasn't even been tested yet. It's just a hypothesis.
And by the way, I wrote the paper. I wrote the abstract. We presented at American College of Gastro. It did increase the bifidobacteria. So it's no longer a hypothesis. It's actually a fact. It's published now. It's done.
Awesome.
But yeah, the hypothesis is still retracted. Keep going down. We're going to go through effectiveness of ivermectin base. These were this was an observational study, okay, that showed that hypoxic patients were treated during COVID. I have consents on these patients. I'm actually going to start doing videos with these people to talk about it because I have their videos of how hypoxic they were. I have their oxygen saturation. So I'm going to showcase this in a documentary. That paper was retracted, an observational study. So keep going. Okay. But, when they're retracted, that tells you that I'm doing something right.
That you're over the target, young lady.
I'm over the target. Vitamin C increases bifidobacteria. This is a great paper. Not retracted, I don't think yet.
It's not pulling up. Hold up. Let's see. Come on, you can do it. Did it do it?
anyway, so it increases the bifidobacteria. And what happens is, you could just show it like this. It increases bifidobacteria. You could tell it's the same journal as effectiveness of ivermectin. So God knows what they're doing with that paper. But basically, we showed that vitamin C increases bifidobacteria. It was shown in vitro because that's how they make probiotics sometimes. You know, they put some vitamin C in there to multiply the microbes in vitro. So we showed that in humans. That's what it does. So that's why maybe, you know, vitamin C helps with viruses, because it increases that bacteria that kind of suppresses the viruses.
I love that.
Gut microbiome alterations. That's a great paper. You could click on it. It should work.
If it doesn't work, maybe not.
Keep going down. Yeah, down. Yeah, there. Learn more. So that paper is great. Keep going down. So this is bovine from cows that we analyze the microbiome. And basically it's the blood of the cow that's spun, and it's that clear liquid. Go down on the papers to show the graph. So what we discovered with that paper is that it actually, if you keep going down.
Okay.
Down. Keep going down. Oh, there you go. Perfect graph. I encourage everybody to take pictures of that graph.
Screenshot.
Screenshot this. If your formula, and again, remember the microbiome testing is that's research in progenobiome. If let's say I end up finding that you have low bifidobacteria, high Bacteroides, low Firmicutes, high proteobacteria, low diversity, the first thing I'm going to do is I'm going to put you on my bovine immunoglobulins, okay, which we call Biome Booster Plus, okay?
Got it.
So it's our bovine. You could find it on the Progenobiome website. There's a link to it. I will put you on that, and I'll say, just take a scoop of that and see if it helps restore, right? On the most part, that's what we discovered with the bovine, which was incredible because we worked with the company. And we noticed that it increases the bifidobacteria, decreases the Bacteroides, increases the Firmicutes, decreases the proteobacteria, and increases the diversity. For the person that has low Firmicutes, for the person that has high Bacteroides, that may be a good thing to have and to try, especially for the person that has, we've noticed some improvement with diarrhea, with some people with diarrhea. But again, this is all research. This is preliminary data. We need more data. I have to say all that because I don't want to be appearing like I'm a snake oil salesman. You know, this is the beginning. This is the beginning of research. You know, this is what I'd like to see. I'd like to see what formula of microbes are you missing? What formula are you having too much of? How do we correct that naturally without having to do a fecal transplant? This paper was a great paper during the pandemic. It's definitely put me on stage with autism. This is a 19-year-old who we did fecal transplant on. And if you go down on the paper, you're going to notice that we gave him his sister's microbiome. Keep going down. Here you go. Stop here. So the first column is the kid with, he had no bifidobacteria. He had lactobacillus animalis. I didn't even know lactobacillus animalis was a bad microbe. And then his sister, you could see, and he had low diversities. He has diversity, Shannon diversity 2.24. See that?
I do. Right here.
And then you could see the Shannon of the sister is 6.69. And the column after is the brother matching the sister. This is called engraftment. When you can match the sister. But look at that. He retained the engraftment up to like 16 months. And the last Shannon diversity, zoom out a little bit. Zoom out. The last Shannon diversity is 6.53, almost matching his sister. Look at the microbes, how different he is from the beginning and how similar he is to his sister.
So right? First column to the last column here.
Yes.
That's
see the difference?
Yes, you see.
And by the way, on a clinical picture, the kid improved his ATAC scores, his CARS testing, which are the testing for autism. He also started speaking, saying mama, baba. He's doing spell like with a board. So he's communicating. He went to prom with a girl. He's growing. He's, remember, amazing. This is a 19-year-old that's restarting back from 2 years old, right?
What a godsend.
Right? I mean, this was a miracle during the pandemic to see that. And it's one thing to say, well, the kid improved, right? But then nobody believes me. It's another thing to see the color graphs that shows the matching of the sister's microbiome, that shows the disappearance of the lactobacillus animalis. You can keep going down.
So this blue one here, when he first showed up,
bad microbe.
Bad microbes. Got
Go
it.
down. And then look, he had a lot of proteobacteria. Those are your bad microbes. Keep going down. And look how it disappeared. Wait, go back up. Yeah, right there. Right. See how it disappeared? Kind of like was trying to go up at 6 months, but then went back down.
I do.
And now it's pretty much low. Now go down again. And by the way, E. coli is in the proteobacteria phylum, if you didn't know. Actinobacteria is where your bifidobacteria lives. It's the phylum of bifidobacteria. He had zero. How
rare.
did this kid kill his whole entire phylum? He killed it. So his sister had a lot. And look how he's slowly growing it. And with each growth, he's getting better and better and better. So this was an amazing case that kind of shows where we need to go. And awesome. The importance of bifidobacteria. You can keep going back to the publications.
Let's go back.
Go down.
Oh, there's more down.
Yeah, so that's the cardiac finding. That's the paper that was retracted with hydroxychloroquine. Okay. The paper after that is looking at anxiety, patients that were anxious versus non-anxious. So there's a microbiome for anxiety. Awesome. We are coming out with a paper for schizophrenia. There is a microbiome signature for schizophrenia as well. Now go back up to the website. I'm going to show you a fun little place. Go about and go to poster presentation. So these are all the posters we have not finished writing that we're in the process of writing. You know, it takes scientists, it takes writers, it takes editors. This was an abstract where we found human DNA in poop, which was an interesting finding. Go to the side.
Wait, why would you be shocked to find human DNA in your poop?
Well,
aren't you a human?
Yes, but remember, they're selling you the microbiome, which is technically microbes in a capsule, right?
No, that's weird.
It contaminated with human DNA in there? So we got to be careful of human DNA in stools.
Well, what's your hypothesis? What's your hypothesis about that right now?
Well, I think, the colonic shedding, as we shed, as we give stool samples, we have human DNA in there. So this is a signature microbiome for Alzheimer's that we published. Keep going to the right.
To the right. Okay.
This is autism and the gut microbiome. So what we did is we looked at kids that were autistic versus their sibling. And we noticed there was a difference between the microbiome of the sibling and the kid with autism. But there was a bigger difference between a kid with autism and a kid that's not autistic living in a family with a kid with autism. In other words, healthy young kids out there with no family members. Because remember, the microbiome gets affected a little bit in kids that share, families that have a kid with autism. It's very stressful for the whole family.
Of course.
And one kid tends to be neglected, and therefore that microbiome is not as solid as it should be. So the importance of looking at the microbiome of kids and siblings in autism, that's my work. That's what we do. We compare family portraits. It's very important because it gives me remember, we're all different in the microbiome. And if we're all different, how can we be compared? But you can compare within the family. So we have a beautiful pipeline that can kind of like show the differences between families, etc.
I love it. All right. So real quick, people are going to be very excited about this information and see how it can relate to neurological conditions, possibly their microbiome, neurological conditions like autism and others. Yes. And then anxiety, emotional upsets. This is phenomenal info, psychiatric. So,
and it's all in there, by the way. There's long haulers and
I get it. So
how microbiome, etc.
Yeah. So how do people take this information and what we're presenting them here and they go, okay, how do I get Dr. Hazan and her research team and lab to start looking to see if their research could help me? Where do they start?
Well, okay, so this is the thing. So research is expensive. Coordinators are expensive. Lab personnel is expensive. Those assays, reagents. Every time we do a run, it's like $27,000. And, if there's a power out and the generator didn't come on or whatever, that's like goodbye $27,000. So
Sure.
it's very expensive. So what we do is we basically, I'm happy to help those that, have seen 20 doctors, have the means, are saying to me, you know what, doc, I trust you. I want to see what you can come up with my condition. People with, glioblastoma that don't have much time and that have tried everything. We're really trying to collect stools right now for kids with glioblastoma because that's a huge problem right now that's in the United States. We're also doing studies on Alzheimer's, Parkinson's. So if you've got that, that millionaire that wants to invest and kind of like on himself first, then we take care of those people. They have to understand we need lawyers to write up the protocols, the consents anyways, because this is outside the loop of practice. We also need the FDA involved, because anything that's fecal transplant needs FDA unless they have C. diff. So anyone that wants to join us, wants to make an appointment with me, can do so. And definitely can use our lab to test their stools. When they can't afford it, we encourage everyone to put their names on the database because, we're collecting names. And, I've done clinical trials my whole life. So I know how to have databases. And whenever I have a clinical trial on psoriasis, for example, I had a database of patients that are on a wait list for the next clinical trial for psoriasis. So I would call that whole database and say, hey, guess what? We just got a study from this pharmaceutical company for psoriasis. Do you want to be part of it? Right? Because that's what research is, right? It constantly evolves, but it's not necessarily there. It's only there when you have the funding to do the research and somebody's interested in sponsoring it. So saying that, we want to take care of everybody, but unfortunately we cannot because we don't have the funds.
Where do they put their name on a database?
Oh, so it's Contact Progenobiome. So if you go to Contact Progenobiome, you just say, I have Alzheimer's, I have autism, I have Parkinson's. Can I be part? Or they can contact Ginger at progenobiome.com and she'll put them on the database. So that's basically the way to do it.
Okay, great.
That's one way. The other way is basically, funding so we could do the proper research. This is not a consumer product. Using the sister's microbiome to help the brother is not a pharmaceutical product that you can make money. And, it's not even a medical, like where a doctor can make money, because really the overhead of a medical practice these days is incredible. And the reimbursement is so low that it's not really feasible to do all these things, right? So when we do it under the research umbrella, but we're very open with patients and say, look, this is what you're looking at. So this is the foundation that we raise money every day to do this kind of research. So it's a 501c3. We encourage people. We've actually supported a lot of the papers that you saw, Bryan, that were written were supported by a lot of people that donated, mainly because of the fact that, we helped so many people during the pandemic. We've helped so many people with, miserable problems that basically can be helped. So the Microbiome Research Foundation. The other thing is we have some vitamins that we've developed in America, the Biome Boosters. All the proceeds of all those vitamins go straight to the Microbiome Research Foundation to support research. So they're good vitamins. The bovine that you saw was really tested. We still test it. I tell the company if I find any problems in there, I'm going to be busting you. So they're kind of like, scared a little bit. But we test every product. I'm very, paranoid. Obviously, I don't trust much. I tested 26 yogurts at Whole Foods and Ralph's and all the shopping centers to see if they had bifidobacteria. And out of the 26, only 3 had bifidobacteria. So, I'm a skeptic, right? I tested 17 probiotics on the market. 16 of them didn't have bifidobacteria. How could they say bifidobacteria and not have bifidobacteria in there, right? So the labels are misleading the consumer. There's a lack, and even organic. Listen, organic is a trademark and it's a brand as well, right?
Of course.
And organic itself, if you think about it, everybody puts organic, but is it really organic? I mean, there's a farm that will remain nameless that says organic, but they spray at 5 o'clock in the morning. That's not necessarily organic if you're spraying pesticides. So, there's a lot out there, and you have to be a wise consumer. You have to be a detective to survive. You have to do the right thing. And to me, that's what it's all about.
I want to show the audiences your products where you can shop for those if they're interested, right? So this is at your Progenibiome. Donate
so
shop
that's
button.
the donate. And the shop is basically, those are the ones, biome boosters. Yes. So
I'm over 18 today. All right. So here they are.
Oh, these are all like products made in America, and
Very good.
there's different combinations. And we have some, usually we have someone that basically, helps save the BIF is my big thing, because it's all about saving the bifidobacteria.
Is that the shirts? Is that what it says?
Yeah, that's the shirts right there. So Save the BIF is really our big, brand of save the bifidobacteria, because there's an extermination of bifidobacteria. And you see the lightning bulb over there. It's like the end of the world. So to me, we got to save the kids. Bifidobacteria is in newborns, in kids, and it disappears as we get older. The process of aging is loss of bifidobacteria. What I'm seeing in a lot of kids is loss of bifidobacteria. The kids with the seizures, I had a kid with 100 seizures that had 0 bifidobacteria.
Wow.
We worked with their microbiome, and the kid is now amazing. No seizures. She's seeing Dr. Fry as a physician.
That's awesome.
And now he's like, believing in my microbiome. I work with the Amen Clinic, Ebony and Cornish and Dr. Amen. They believe in my work as well. I work with Dr. Sheldon Jordan, who's like the top neurologist, in my opinion, in the world, who's an interventional neurologist. I work with a lot of very amazing physicians that are academic and non-academic, and have been really the innovators, right? And I think all of us during the pandemic kind of like shook our heads in that what was happening, that push of one narrative, that censorship of another narrative, was just not science. And it was really like, muzzling down one pathway, which was wrong to do, because we're all different. And listen, I was a keynote speaker at the American College of Cardiology, and the guy that was the chair of the meeting said to me, he said, we don't know. The reality is all of us go with one idea and we believe in it. Think about the statins, right? And then we follow that, and that becomes our career. But we don't know. There could be something else. Like, think about the vitamins right now. I love vitamins, but maybe there's something better. Maybe there's something else that I'm missing. Maybe we've got to be open to everything. Like I'm the person that always looks at everything and I go, well, let me try this. Let me try that. Probably that's why I ended up doing clinical trials for so long, is I was so excited to see what's the next product. What's the next product for Crohn's? What's the next product for Alzheimer's? What's the next, product for Parkinson's? How I want to see it myself first, because if I see treatment works first, then I can be behind the pushing of it. I can truly influence patients, right? Because we all become influencers, right? I mean, think about Dr. Fauci was an influencer, Dr. Hotez is an influencer. We become influencers, but we need to see the data as it is, and we need to be objective, and we need to be humble that we could be wrong. And I always try to keep that in mind, even for me, where I, again, like bringing us back to the hydroxychloroquine, I patented the product, but at the end, it wasn't the right thing for me to push, because I said, what if a kid is taking it? Now I'm killing their microbiome, because there's such a fear factor that occurs for parents, especially. Parents want to do the best for their kids. Of
course they do.
So they're going to believe the trend of, oh my God, I got to vaccinate my kid because I don't want to get measles, mumps, rubella, polio, etc. And that's fine. That's great. That's what we were. That's what we've learned. But Science evolves, and then we learn about the microbiome, and now we got to protect the microbiome. We got to preserve the microbiome. So when I hear that kids are taking probiotics that are healthy, I'm not talking about the kid that's non-healthy trying probiotics to make themselves better, but a kid that's healthy, that's at the gym, that's running a marathon, that's playing tennis, and the mom is giving them a probiotics to protect them. Why are you doing that? That kid is healthy. Let him grow. Let him survive. Let him fall. We tend to be
I
these
agree
parents
100%.
that are like holding on these kids. I did that with my first kid, and I screwed up. I was holding her on too much. I was telling her what to do, what material to study, what probiotic, what not probiotic, but what, antibiotic to take, what food to eat, everything. I was squishing her. I didn't let her grow develop her immunity, falling, hurting herself. I was always there. Here's a pill. I was sterilizing everything. And then my second kid, I just latchkey kid, I'm like, you know what? I'm too tired. The first one drained me. I'm just going to let you grow. Right. And the difference between those two is incredible in their confidence, in their, now the second one, my oldest is like amazing. She's super confident because finally I just let go. Right. When you let go of a kid and you basically let them, build their immunity, let them fall and learn how to climb up. If you keep holding them, they'll never grow, and they'll never learn, and they'll never be warriors. And then when they have a cancer or they have a neurological, they need that holding on to, they need, they haven't learned to build up that warrior mentality.
Of course. And we need to do the same thing in the bowels, what I'm learning. So one of the big
Yes.
takeaways for me in this conversation, thank you very much, Dr. Hazan, for bringing me up to speed on all your research the last 30 years. I think one of the things that we've realized, not only as a society, but now with our health, it really is not segregating individual microbes and analyzing those and trying to treat those. The more the diversity in the bowels, the better the health outcomes for most people is. Very similar to what we have found, I believe, over the last 50 years as we've integrated society. There's been a lot of benefits to bringing everybody's mindsets, all of their cultural experience, all of their knowledge to the actual entire group. Provides a massive benefit and dividends long-term, even for the health of society, as it would our gut and our bowels. All right. One last thing here I got to touch on before we go. You've already touched on a few conditions, psoriasis and alopecia, that are very visual. So you can see their symptoms that these people have. Eczema, rashes, hives, psoriasis, scales, gouty arthritis, even topically, and then alopecia, hair loss. How connected to the gut is it to our skin's health?
Well, it's all connected. You fix the gut, you fix the skin.
Amen.
I have a celebrity who will remain nameless, who I put on a protocol, and she had horrible acne, and then called me like 6 months later and was like, "Oh my God, I stuck to your protocol and my acne is gone. You were right." And you just got to stick to it. You got to stick to one protocol and just, make sure you're eating the right foods, you're taking the right products, the right nutrients, the right everything, and then you should be fine. I think, but yeah, you heal the gut, you heal the skin.
Now, after 30 years of gastroenterology
heal
study,
the sinuses, by the way, even sinusitis is a gut dysbiosis.
And you've learned from a research study's titles, you look at the psychiatric effect, the neurological effect, the systemic viral biome effect of COVID. You saw the interaction there with all those symptoms. Picture anything related to COVID. She found it in the bowels being complicated. Got it? Okay. So it's all connected. How much more, let's see, how much more truthful is this statement now 30 years later? That the immune system primarily resides in the gut. Is that still true for you 30 years later? And has it become magnified and more truthful for you?
More truthful every single day.
That's
more
awesome.
Truthful. More
I wanted
truthful.
to hear it. You've heard it here from the gastroenterologist.
And remember, I've been the guinea pig, right? I'm exposed to everyone, so it's like seeing my microbiome being imbalanced and surviving COVID, surviving, That's really been an eye opener for me. And
Awesome.
and it's not just me. It's like seeing other patients, that are doing amazing. You heard of the people that never got vaccinated, never got COVID. They have a resilient microbiome, and it's not necessarily about the nutrition. It is about the nutrition, the right nutrition, but nutrition is specific to that person. And that's something we'll talk about on the next episode when I'll have more data.
And one more exciting thing, I've invited Dr. Sabine Hazan to come to our Healing for the Ages 3.0, and all things good. We're praying it all works out and no crazy wildfires, earthquakes, or the whole shelf of California falls off in the ocean like I've heard for decades. She will be there October 22nd to come there and talk about how to make yourself healthier again, including the gut and things you can do. It's going to be very exciting to have you there. I cannot wait to have you as a list of the lineup there to educate people on how things in the body contribute to your symptoms, your health outcomes, and your quality of life overall, and longevity. As you mentioned, even aging is corresponding to the diversity in your bowels. And who doesn't want to live longer and healthier and more youthful? Dr. Sabine Hazan, thank you very much for your time today. I want you to give the audiences around the world, actually, we have an international audience. I want you to tell them what kind of hope you have for them in the future of research and their knowledge and your knowledge you're gaining and the promise from the things you're producing to sell them to improve their outlooks on health.
I have hope in the future. I mean, I think, we're more and more united on a common front, which is we don't want to have diseases anymore. We want to eradicate disease. We're tired of chronic diseases. Every person has either a father with Alzheimer's, a sister with Parkinson's, or a brother with Parkinson's, or a kid with autism or seizures. Disease is in everyone. And I think we're all united on that common front. It's not, the Make America Healthy Again was not just for America. It's really around the world. And I think all of us as mothers who want to see our children grow healthy, we don't want to push things that are just going to deteriorate them. We want to be, why I stepped into this is because I had a vision with autism. Autism is 1 in 33 right now, if you look at New Jersey, and 1 in 36 in general. By 2030, it might be 1 in 1. And I didn't want to see my grandchildren have a problem that I could fix right now. So I stepped into this as a mom and as a possible grandmother in the future. I always look at my life like 100 years from now. I think it's important to not live your life for yourself, but to live your life to say, I'm going to contribute for the whole of humanity. And I'm going to make sure that when I leave the planet, I've done my darnest to make the world a better place. I can sleep at night with all the work I did with COVID. I don't need awards. I don't need money from it. I just can sleep saying, you know what? I did good during COVID. I lost no one. No one died on my ship. Treated thousands, So that makes me feel good. And, I won't have any regrets. Stepping into this pandemic, stepping into treating COVID, treating Alzheimer's, Parkinson's, autism, trying to change that direction of research, to me there's no better way to live your life. It's about helping humanity. And here's the beautiful thing about humanity. We're all going to come together, whether we like it or not. As different races, different religions, we're all going to come together because we're going to realize that much like the microbiome needs diverse microbes, humanity needs diversity of humans to continue to develop, to continue to have innovations, to continue to see further and to looking into Mars and to looking into other planets and digging into the soil and digging into our microbiomes and seeing where does the microbiome go after we die. That's the most incredible thing for me that I want to answer in this life is what happens to these microbes after they consume the bodies, right?
That's an amazing question.
Do they come back? Do they stay in the dirt? Do they, this is, when you think about a group of microbes that consume a human being and put it back in the dirt, and those microbes are still there, they're still alive. You can't kill them. We've been focused on kill the bug, but really, you're not really killing the bug. You're just suppressing the bug with other bugs. So we really need to understand the war in our guts is between microbes. And those microbes we are a reservoir for them, and they allow us to be happy. They allow us to be sad. They allow us to be whatever we want to be. So I think it's important to understand that. And I think it's important to come together as humanity. And because all of us are not perfect, all of us are suffering.
Yeah.
So,
and also moving forward, right? So what we're saying here is there's a biodiversity of microbiomes on our skin surface, correct? I think you mentioned that earlier.
Yes.
In our bowels, in our mouths, in our sinuses. So what you're saying is drinking Purell antimicrobial hand sanitizer is not the cure for all chronic illnesses, or lathering up all over the place to kill your microbes with alcohol all over you. That's not really the solution. You need the biodiversity that makes up all of human life, all of nature. It's found everywhere. It's in the dirt. It's on your trees. It's on your pollen. It's on your bees. It's on your insects and your animals.
Absolutely.
You name it. So the preservation of the biodiversity of our microbiomes that is found on our skin, in our bowels, to advance our health and maintain our health. That's what you've learned here.
Yes.
Dr. Sabine, thank you so much for your time today. God bless you all. I'm Dr. Ardis. This is the Dr. Ardis Show. I hope this was helpful, inspiring to you. And hold up your book again. Everybody get Let's Talk Shit. You rock. God bless you all. Thank you, Dr. Sabine. We'll see you next time. Thank you.